uh, we are going to go for our next video. Sorry my friends, I was busy with something else, that's why I couldn't upload the video recent last few days. So we are going to do it today. Navi's staging of carcinoma gallbladder: stage 1 intramucosal only, stage 2 extends to muscularis propria, stage 3 extends through the liver, stage 4 transmural involvement, stage 5 direct extension. Nottingham Prognostic Index PI: Nottingham PI 0.2 into tumor size plus N 0 equals 1, 1 to 3 equals 2, and more than 3 equals 3 plus C 1, 2, 3. Nottingham PI less than 5.4 good prognosis. Nottingham PI more than 5.4 bad prognosis. Overall survival less than 50% at 5 years. Squamous metaplasia of columnar epithelium, gallbladder, and bronchus. Squamous metaplasia of transitional epithelium, renal pelvis, urinary bladder, Raynaud's phenomenon. Stage 4 ischemic gangrene. Let me see. Ischemic gangrene. Stage 1 is stage of local syncope or pallor. Stage 2 local sinuses. Stage 3 rate engorgement. Triad of urethral rupture, blood at urethral meatus, inability to urinate, perianal hematoma. In major burn injury, patient may develop stress ulcer which may manifest with upper GI hemorrhage. Stress ulcer may be prevented by using S2 blockers, ranitidine or famotidine. Proton pump inhibitor, omeprazole, pantoprazole, sucralfate. Important causes of acute pain: AMI, basal pneumonia, empyema, thoracic thoracitis, acute cholecystitis, acute pancreatitis, acute cholangitis, acute peptic ulcer perforation, liver abscess, acute retrocecal appendicitis, acute intestinal obstruction, right-sided renal colic, acute right-sided pyelonephritis. Intestinal obstruction, pain, vomiting, and ABS constipation. Differential diagnosis of radio-opaque shadow in region of gallbladder and kidney stone, gallstone, pancreatic calculi, foreign body, fecalith, phleboliths, calcified lymph node, calcified renal TV, calcified adrenal gland, cliff fracture of transverse process of vertebra, or calcification of costal cartilage, radio-opaque renal stones, oxalate, phosphate, cysteine, xanthine, radiolucent, uric acid and urate, renal stones formation reasons: urinary infection, urinary stasis, vitamin A deficiency, decrease in urinary citrate, prolonged immobilization, hyperparathyroidism, altered urinary solutes, and Collois-Randall's plaque. Appendicular lump, inflamed appendix, adjacent terminal ileum, cecum, and greater omentum. USG and CT may demonstrate pus within an appendicular lump, presence of SIRS, defined by presence of two or more of the following: pulse rate more than 90 beats per minute, rectal temperature more than 38 degrees centigrade or less than 36 degrees centigrade. WBC count more than 12,000 per mmq or less than 4,000 per mmq. Respiratory rate more than 20 breaths per minute or CO2 tension less than 32 mm per Hg. A loose or partial fundoplication should be done concomitantly during cardiomyotomy. Barium swallow, carcinoma esophagus, irregular feeling defect, dilated proximal esophagus, and narrowing at mid-esophagus. Palliation of dysphagia in advanced esophageal carcinoma. Endoscopic staining by Celestine or Atkinson tube brachytherapy to deliver intralaminar radiation. Barium meal, X-ray chronic duodenal ulcer, loop of duodenum deformed, duodenal bulb. Benign gastric ulcer, fundus of stomach, ulcer crater at the lesser curvature of the stomach, cancer crater at the lesser curvature. Ulcers along the lesser curvature are mostly benign. Benign ulcers are usually round or oval, whereas malignant ulcer is irregular. Double contrast barium X-ray of stomach, the duodenum, injection of Buscopan, and tablet composed of calcium carbonate and anti-foaming agents releases carbon dioxide. Patient is given 150 to 200 ml of high-density barium. Causes of duodenal obstruction: large band, high insertion of ligament of Treys, duodenal stricture, neoplastic lesion. Important causes of small gut stricture: tuberculosis, Crohn's disease, actinomycosis, primary carcinoma, lymphomas, carcinoid tumors, radiation enteritis, ischemic damage, intramural hemorrhage. Medical treatment of Crohn's disease: corticosteroids, oral corticosteroids in mild to moderate Crohn's disease, parenteral corticosteroids in severe Crohn's disease, sulfasalazine useful in mild to moderate Crohn's disease, immunosuppressive agents. Azathioprine reduces the dose of steroid. General treatment: maintenance of nutrition, correction of anemia, hyperproteinemia, electron imbalance, acute appendicitis, low-grade pyrexia, muscle guarding in right iliac fossa, cutaneous hyperesthesia, rebound tenderness, Rovsing sign, Sower's shine, obturator shine, Jacqueries cup, Olabdia. WBC count increases, polymorphonuclear leukocytosis increases, C-reactive peptide increases. Incision for open appendectomy: McBurney's, Grady-Roan, Lance midline, right peroneal incision. There are several terms I have already summarized them, so sometime in a hurry when I go to those pages, even I don't understand what I've written, but they all are really meaningful. And it also depends on more and more revision, so revision is very must. I guess my revision, what I have done, is still uh, unsaturated, we can say. Okay, we carry on, my friends. Tension pneumothorax diagnosis, severe respiratory distress, sinuses, mediastinal shift, hyperresonant percussion note, negative breath sounds. How to treat traumatic hemothorax, massive bleeding, 1 liter of blood drains on insertion of drainage tube, brisk bleeding, bleeding more than 100 ml every 15 minutes, continuing bleeding is more than 200 ml per hour over 3 hours. And a mammography for breast malignancy evaluation sensitivity true positive is 90%, false positive 10%, false negative 6 to 8%. Etiological factors for development of intussusception: benign tumor in gut, malignant tumor, Mikulicz diverticulum, internal tuberculosis, Hanoch escalane purpura. Characteristics of Mikulicz diverticulum: plus 2% population about 2 inches long. The base is usually wide mouthed. Congenital abnormalities in patients with Mikulicz diverticulum: exomphalus esophageal atresia and rectal malformation, cardiovascular and nervous system abnormalities. Complication of urethral dilatation, false passes, bleeding, fistula formation, infection, restriction. Vicryl rapid maintains tensile strength 14 to 12 days and get absorbed in tissues in, let me see, 42 days. We're coming to the ninth note. Indication of total gastrectomy. Adenocarcinoma of stomach exists involving large portion of stomach, Zollinger-Ellison syndrome, life-threatening gastric hemorrhage. Peptic perforation, post-operative management, antibiotics, cefotaxime, 1 gram IVBD, amikacin injection 500 mg IVBD, metronidazole injection 500 mg IV TDS, and IV ranitidine or omeprazole. Reconstruction after pancreaticoduodenum pancreaticoduodenectomy. 1. Choledochojejunostomy, pancreaticojejunostomy, gastrojejunostomy. Structure preserved during moderate radial mass, long thoracic nerve, thoracodorsal nerve, cephalic